My name is Shadaris Phillips, and I will be discussing the health policy that I support and will represent my position on is the opioid overdose crisis. In reference to the opioid crisis, I'm going to be talking about the policies such policies such as the Comprehensive Addiction and Recovery Act 2016 and the 21st Century Cures Act. The rates, my purpose for this video and talking about the opioid overdose crisis is that the rates of opioid misuse and addiction is currently out of control. According to the National Institute on Drug Abuse, they estimated that 130 Americans die from opioid overdose a day. The misuse of prescription pain relievers, heroin, and synthetic opioids such as fentanyl is a national crisis, and policymakers are attempting to address this problem as quickly as it's occurring. So, as a healthcare worker, I witness this every day. These statistics are real. The statistics I'm going to give you are real. Patients are being prescribed opioids as if it was candy, and now this all began in the early 1990s. This is coming from the National Institute on Drug Abuse in the 1990s when pharmaceutical companies put out an article stating that opioids were less addicting than what they are now. And so physicians would overprescribe opioids. And so now we're to the opioid epidemic now due to that overprescribing in the early 1990s. So here's some statistics on the opioid misuse and crisis. Roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them. Between 8 to 12% develop an opioid use disorder. And of that, 46% who misuse prescription opioids transition to heroin or other street drugs. This right here is large. In the Midwestern region, they saw opioid overdose increase to 70% from July 2016 through September 2017. With all these statistics, now you see how much of big of an epidemic it is in America. It's a problem that policymakers see and are now trying to address as quickly as possible. Now, the policies that policymakers have created are two, such as the 21st Century Cure Act, which provides funding for authorized programs that strictly address and help with opioid addiction during the 2017-2018 fiscal year. Also, we have the Comprehensive Addiction and Recovery Act of 2016, with authorized grants in opioid abuse prevention and treatment activities, which includes, now this act, the Comprehensive Addiction and Recovery Act 2016, is still occurring today. And the components of this act, which includes improving prescription drug monitoring, training for healthcare providers, and expanding access to opioid treatment programs, is a big deal. It's important that on discharge we assess our patients if they have any dependencies on these opioids. Right? So we could get them into transitioning programs to wean them off of them or find another pain reliever supplement that can help with their pain or whichever disease process that they are going through. Continuing on with expected lawmakers are now exploring policy solutions such as healthcare providers who prescribe opioids. They're thinking about requiring healthcare providers who prescribe opioids to complete continuing education, expanding the Drug Enforcement Administration enforcement authorities in response to the opioid epidemic, strengthening requirements for state prescription on drug monitoring. In conclusion, these are just a few of the things that policymakers are doing to address the opioid epidemic in the United States. They are currently in the works of making other policies that can address this epidemic, which is huge. Therefore, I support this particular healthcare policy because something needs to be done, and policymakers are doing it. So thank you for listening to my video.